Stabilizing what? Block. When you use the cervical block, how do you use this? Anybody remember? Did they ever teach you? How? Curved part goes down. Because you're trying to stabilize the atlas with this. And if you have this like this, it's no way going to stabilize the posterior arch. Right?
What?
You don't. Should I repeat that?
No, I agree with you.
Okay. All right. Cervical blocks. They come in different sizes. This is more for a narrower neck. So we need somebody with a real narrow neck. Rami? That's a joke. Okay. We're going to, first we're going to analyze this, right? And the way we analyze it is how? Palpate the TMJ. And I don't want you down here like on the ramus, or I want you at the joint. Okay? I don't want you at the angle, or I want you to be here. So, have the patient with their head extended. We're going to be looking right at the symphysis menti. We're going to have the patient open their mouth as wide as they can. Then what we're going to do is have them slowly close. Oh man, did you see the way his did? It went like this, and then it went like this. Now, if you remember me teaching you, the side that goes in first is the good side. And then it goes over to the bad side. Right? And so what we're trying to do here is we're going to try to slow down the good side so that it doesn't close and catch the bad side up to it so that we can restore this normal tracking motion. And if you look at the joint, you see how the joint functions. We're going to have to, it'll usually go anterior and inferior and lateral, so we're going to have to sort of lift it back up in here. And there's a little disc in here, by the way. So it'll help you to, the more you understand it, I'm going to put this right behind my patient, right? I'm going to bring my patient back this way. I'm going to use my thenar, my pisiform, and my fingers down on the rami, and I'm going to have him open his mouth. And as he's closing, very slowly, I'm going to be adding pressure behind it. So he's not going to let me rush him. He's going to be slow. He's going to be going at the same pace, and I'm going to be adding pressure the whole time. Does everybody understand that? Mm-hmm. So he opens his mouth, and then he's closing it very, very slowly. And as he's closing it slowly, I'm bringing this over, and I'm going to bring them both in together. Okay? Try again. Open. Close very slowly. And you want them to come in nice and even. Okay? You can always post-check that, have the patient open their mouth, close. It's a little bit better. But the idea is to stop that. Remember I told you clinically, the first thing you want to do when someone comes in with a TMJ problem is what? Check their upper cervical spine. Check the AO joint. Make sure that that's right. Okay? Might be occipital, maybe an atlas, maybe even an axis, but check that spine out when you do that. Okay?
How is that affecting the jaw? There's no
I don't know.
connection at all.
I don't know. I can't tell you the connections between the spine and all these things that happen inside the body. I can only tell you from a practitioner of this healing art that I have seen seemingly unrelated mechanisms taking place where people's body just responds. And this is something that people have found when there's an upper cervical problem and a TMJ complaint. If you correct that upper cervical problem, very often that TMJ complaint just goes away. So.
If you have C1 rotation, that will affect the transverse, will be closer to the mandible.
Yeah, but I don't know